Hi, my name is Alexander Angulo, and I'm a first year undergraduate student at the University of Illinois. And today we're going to be talking about the biochemistry behind surgical anesthetics. And this is an oversimplification of the actual process, but let's dive right into it. So, before we talk about anything, my personal interest in anesthetics really stems from me dealing with multiple surgeries throughout my life, and I've dealt with both general and local anesthesia. And I was always really fascinated as a kid by the actual mechanism behind how the actual neurons get disrupted in the body. So that made me want to do more research into this area of study, and then go on to pursue my medical degree after my undergrad. So first, we're gonna have to understand what an anesthetic is, and an anesthetic is an FDA-approved chemical drug that's going to be primarily used in some type of operational medical procedure, and it's going to induce a coma-like reversible state of a patient, or just in general numb any type of pain. So there's many different types of anesthetics that are used in the medical field, but and that makes it really important for understanding because these different types of anesthetics all have different types of effects in the body. So understanding types of medications can really help prevent risk for patients, such as like different types of irregular heartbeats or potential awareness during surgery, or even types of allergical reactions. So the better you understand this, the better you understand how fast these occur in the body, and can really help your patients. So next we're going to talk about neuron signaling for anesthetics, and specifically we have to understand what the central nervous system is. And the central nervous system is a network of neurons that are going to be in constant communication with each other through something called a neurotransmitter, and which is a type of chemical signal. And these will often just have this polarization, depolarization of action potentials in the cell or in the type of neuron that go through. And what they're going to do is have a constant signal information that are going to trigger these types of responses throughout the body and send different types of feedback back. So there's many different types of neurons in the brain, or in motor neurons, or even types of sensory neurons. But specifically, we're going to be talking about local anesthetics. And within local anesthetics, we're going to be only targeting two different types of neurons, which we're targeting motor neurons and sensory neurons within the muscle fiber. So specifically, how this local anesthetic is going to work is we're going to be talking about something called a sodium ion channel. And what the local anesthetic is going to do is it's going to go in and block the actual channel, disrupting the actual signal of these of the actual membrane, which is going to disrupt this actual constant flow of sodium ions getting passed through, and that's going to block that CNS signal. So now we're going to talk about the actual chemistry behind anesthetics. And for local anesthetics, we're going to talk about two different types of examples of an lidocaine and procaine, and they both have something called an aromatic ring, which is going to be a non-polar ring closure, which is going to be something that is very lipid soluble because it's nonpolar, and it's going to dissolve really easy into through types of lipids, which are fats. And then the main difference between the two is this amide bond and ester bond. And within this, an amide bond is it's NHC double bonded O right here, and specifically what it's going to do is make it stay in the blood longer, versus ester bond, the COO right here, is going to make it dissolve faster. So what we can take away from this really is that these different types of functional groups in these anesthetics are going to really change the actual lipid solubility and the type of mechanism that are going to be used to inhibit these different types of action potentials. And also, we really have to understand that everyone's genetically different, and how people's process these anesthetics really is going to change for everybody individually. And then just one more way of thinking about this is almost like an interconnection to your phone, and how if you disrupt that internet connection, then everything basically shuts down. So thank you for watching, and hope you had a great time.